Welcome to the March 28th HHRC meeting. I'm going to call the meeting to order. As our first order of business, I'm going to move to approve the minutes which were sent out via email after our last meeting. All right, GG is seconded. All right, so our next action is to review action items from our last meeting. Sorry for some confusion on the agenda. That was me. We're gonna have safe passages come in April to discuss services for victims of domestic abuse. But we do have a visitor who can contribute to that discussion so we can learn a little more. So we can address that action item, which is kind of following up about that. So if our visitor would like to introduce themselves.
My name is Ben Flynn. I'm the sheriff of Jefferson County. I've been in law enforcement in Jefferson County since about 2010-ish, prior military. So I am willing to help out if you guys need.
Okay.
So.
Well, for a little background information, I can kind of give a review from our last meeting. We had a community member come in and kind of describe an experience they had. They were helping out a family with an excess of cats. And in that process, became aware of possible domestic violence situation, domestic abuse, and the person who was the victim in the case reached out to her for help. And there was kind of, there were a lot of notes from that.
There were some opportunities.
Yeah.
She was trying to get her in touch with a group towards Cincinnati.
Batesville.
Well, they had that one, but I think she was.
There was first one in Cincinnati. And the community member wasn't aware or had forgotten about, didn't know about safe passages.
Right.
But her frustration too was the victim was in the county, had called law enforcement.
Or somebody had.
Oh yeah, it was another third, fourth party had. And then they had driven her into the city.
Of Madison. Because it was outside of Madison.
It was in the county, in Jefferson County, then the person was brought into the city to the cat helper's house or
Well, I guess
alley.
you just know what would be your normal process if someone called and they needed to go to safe passage? Do you have a number that you can call them?
Yes, our officers have pamphlets in their vehicles, and we also, part of our working in conjunction with the prosecutor's office, we have a domestic violence packet that we always fill out. There's a domestic violence packet, a checklist, lethality assessment, victims' rights, VINE forms, and safe passages. I think is one of there's a couple of different phone numbers on there that we have to provide them by statute, that we give them their victims' rights as well as their numbers that they can call. And sometimes they're willing to fill out lethality assessments. But what you'll run into a lot is they'll go through that checklist and they'll do the lethality assessment. And if they screen high enough on that to where you're supposed to call the hotline and screen them in and provide them the phone and let them talk and try to get help or counseling, shelters, whatever they need, whatever resources they may need. But you always seem to hit a wall. It seems about 8 out of 10 times where they will go, I don't want to talk about it right now. So that's the frustrating part, because you want to help, but then they shut down, or they feel that their perpetrator, their batterer, whether male or female, is maybe the breadwinner of the family, and they're going to, potentially lose their home, that fear, that unknown fear of whether or not they're gonna be able to have a roof over their head going forward down the future. If they put them in jail, are they gonna, lose their allowance? It's just all about control. So they get scared. So you have to try to really kind of break down to their level and just be as compassionate as you can with them. But a lot of times it still doesn't help. So, we've been giving them those packets in hopes that they will, maybe later on that evening, they'll meet with a loved one, a friend, a family member, someone else that's been a survivor of domestic violence, and maybe they'll, see the light and reach out, and get help. So we try to provide as many resources as we can, but a lot of times you hit that threshold and they just don't want to go past. And then we 5, 6, 7 times been to that house for the same situations, and they're just like, nothing happened here, I don't know why you're here, you need to leave. There's nothing going on here, you guys are just harassing us. So I'm like, we didn't call, you called, or your neighbor called because they're tired of hearing this every night, and their kids are hearing swear words across the yard while they're playing in the sandbox, whatever the situation may be. Domestic violence is, I don't know, it seems like it's ever growing. It's an increasing problem in the community nationwide, not just Jefferson County. So any help that you can provide, or resources or tools that you can reach out to them, the better, I feel. So
From your point of view, would there be like a resource that you could think of that would be helpful that we don't currently have in our county?
I know shelters, I think is it the Heart House? The one in, Dearborn County?
Yeah.
That we use frequently. A lot of times we hit a wall there. If they do, request that, hey, is there a place I can go? And then you're like, yeah, we got this place in Dearborn County, and they're like, oh, I don't want to go to Dearborn County. I would like to stay local. My friends and family are here. What am I gonna do there? So maybe a local resource may not be as starting out like a long-term, like the Heart House is, but maybe something that could provide 12, 24 hours worth of,
Like a safe
shelter.
house.
To kind of allow them the opportunity to have to facilitate with resources and find other housing, if they have children, are they trying to work? And that's another thing I've hit before in the past, is they don't want to go to Dearborn because they don't want to take their kids with them because their kids are in school. And they don't want to have to pull them out of school locally to go to Dearborn County, to have to drive them back the next day, and they may not have transportation, or so local resource like that would be, I don't know, tremendous, I would think, but it's all I can think of off the top of my head.
Okay. Yeah, I think another thing, just from what our visitor in our last meeting said, having pet-friendly safe houses is also like a desired thing. Because with that particular case, part of it was with all these cats. It was like, they didn't feel like they could leave without some kind of cat apocalypse happening. It was like,
Or like maybe even
Yeah.
working with our local,
I mean, I get it.
temporary shelter
Yeah.
for animals maybe while they.
I don't think you're ever
I
gonna,
don't think you can bring like 30 cats to a place. but
Yeah.
like, if you have a
Your
dog,
problem-
you don't wanna leave.
your
with
problem
your
with that is- I would think your problem with that's gonna be, do your animals have shots? Do they have? You're not gonna wanna bring, I know, yeah, I think that's virtually impossible. And that, maybe if you had an MOU or some sort of memorandum of understanding with the shelter, that maybe they had a kennel or
Extended shelter location.
like a spot reserved for that. I mean, I don't even know if that's feasible with all the overcrowding that's there. It's one of those things, unfortunately, I think that the ultimate goal is to protect human life at that point and to, you know, sustain the victim. I don't know, that's a tricky one, I guess.
So is it the victim that's removed from the home and not the perpetrator that's removed from the home? Is that, I'm just asking to understand.
No, you're fine. Theoretically, if there is evidence of domestic violence, whether bruising, cuts, scrapes, you know, abrasions, there theoretically is an arrest made, of whoever. And see, domestic violence is one of the charges in the state of Indiana and a lot of other states where you kind of have, immunity if you make an arrest out of good faith belief that you are arresting the perpetrator, and it's later found out through the course of, you know, court or depositions or whatever, that maybe you arrested the male, and maybe they find out later that the female was the primary aggressor. They, won't hold you liable for that because you were just making a, you know, a good faith decision. So you have immunity there, but we try to, if there's been a physical struggle, especially if there's kids in the house, that we try to remove that. We try to pull that volatile unit out of the house and make an arrest on that, so.
And how long is how long is that house not occupied by that individual? And how long is that person, the victim, want to be able to stay in their home and not feel threatened before that person gets out on average?
So what they will do, that's a good question. I say typically because there are some caveats to this where, however, we'll call it the picture perfect moment would be that that person is arrested, they're taken to the sheriff's department. One, they don't have a bond for domestic violence is non-bondable offense. You have to go before the judge. You have to see the judge will set your bond. Typically, the judge can issue things like, community corrections, release you to community corrections and place you on an ankle monitor. And they will make an exclusionary zone around that house to where they can't violate that zone. And if they do, that's an added charge. So that's one avenue. Another avenue is they will issue, typically as a condition of your bond, they will issue a protective order, ex parte order of protection. And it'll basically say that you are excluded from going to that house or being around kids or being around whatever it takes to alleviate the threat or fear of domestic violence. So if you violate that, then you're looking at another charge on invasion of privacy. So those are a couple things that you can do. However, on the latter part of that, the prosecutor's office will always petition that. But what you'll find out sometimes is the victim will be semi-uncooperative and they will call the prosecutor's office the next day or 2 days down the road and they will go, I want that dropped. You can't tell me that I can't be around such and such. You have no right telling me I can't be around my husband or my boyfriend or whatever. And typically, if enough pressure is applied over a course of time, they'll eventually probably release that because they're gonna violate it, you know, anyway. But I know in the state of Indiana, you can't violate your own protective order. But legislation in Florida, where I started, you could violate your own protective order. So if I go and I get a protective order against her, and I say that she's abusive and they award it to me, and then they say that she can't contact me. But if I contact her in the state of Indiana, you don't get in trouble. But in the state of Florida, if I or her contact each other, you can violate your own protective order. And that's just differences in legislation between the states, so.
Yeah, I think, one more thing about that, situation, the person who came to talk to us, I think got in deeper than they were expecting to. Because the victim got dropped off in the alley behind his house one night without like any warning. And then had to be picked up by the family at her house, so she got kind of, like,
She
her
felt
home.
unsafe,
Yeah.
like she didn't know this victim was coming to her home or
Okay,
the space outside her home. And then she was fearful for her family, especially then when the aggressor family.
became aware of where she lived. And
yeah,
so-
in some cases, some incidents, if you live in a home, your household members, can typically, as long as you, let the prosecutor's office know about it, they will allow you to add them to that ex parte order of protection, even though it's a sheet of paper, but nevertheless, you can't harass, stalk, annoy through, indirect, direct, or third-party communication violate that order. So you can't email, I can't call. If I have a protection order against you and that's your grandpa, no offense. I'm theoretically, run it out. I can't call him and say, hey, I need you to let her know that, I don't want her driving my car anymore. That's third-party communication, so that would be a violation, so.
Yeah.
There's a lot of things out there that help protect the victims, but maybe a little more awareness as to what those actually are, maybe explanations, in court, if they're at open court, to make sure that we go that extra step. I know the victim's advocate down at the prosecutor's office, they try to reach out to them and let them know victims' rights, but that's why I think it's also imperative that you make sure that you establish that victim's right in the domestic violence packet and make sure that they are aware of the different steps to alleviate that added threat or that added fear or anxiety that they may experience. So, more training, officers training, domestic violence training is always good. It's, I'm pretty sure Safe Passages is a big proponent of sending people down and putting on that training. So I know we have a huge training room now at the sheriff's department, so, we would be willing to host, that training if they were willing to come down. We could invite HPD, MPD in Jefferson County and, the more training, the better. So helps get the awareness out there.
So one question I have, just kind of related to that situation, I mean specifically was presented in Power Commission. Is there any, because I can see this happening both ways, right? So the way that this woman was dropped off there, it's like where she told the sheriff's officer that she wanted to be dropped off. So I'm guessing just like the kindness or favor or to remove her from this situation in her home, they did that. Would there ever be a time where they might say, well, let's call it head or check, like, because I think that was the thing. This person was caught off guard, did not know that police were bringing this person to her home or the parameter of her home, and then later city police were involved, and then family came to get the person, like,
They
it
didn't really
was
know.
an whole situation. And I'm
Yeah.
like,
Um,
so I can see how officers would just be like, okay, sure, if that's a safe place for you, we'll take you there, but then also it then made this person feel like
Feel uncomfortable, sure.
uncomfortable, and like, I don't hardly know this person.
And I don't know, I guess that's where it's probably one of those things that you're just at the adult stage of your life and if I'm a police officer and I'm on scene and you're like, hey, I'm gonna go stay at, my friend Margaret's house or whatever, and, oh, do you know where they live? Yeah, they live at 000 Walnut Street, okay. If you need a ride, I'll give you a ride, to help alleviate the situation, and I guess it's just one of those things, it's an assumption that's made that, hey, if they know where they live, they know their phone number, they know their name. If they're willing to take them in, then, great. So you give them a ride down there, I guess, I guess you're putting a lot of trust in the fact that that person's not gonna set you up for failure in a sense, but I could see where that would be,
Far better than taking it back to where they just came from.
yeah,
you know.
I mean,
And
and
it's just,
if we had, there it goes back to the same, you know, if there was someplace potentially local that we could take, that situation, you know, to a safe place in lieu of taking them out to, you know, Sister Bob's house, you know, Sister Bobby's house or Brother Jim's house or whatever, at 2 o'clock in the morning and then waking up all their kids in the house and they see 4 police cars and a hysterical, you know, woman that's, or man that's screaming and yelling and cussing and swearing about what just transpired on their worst day of their life. That's, would be a way to alleviate that added.
Yeah.
Totally agree.
Yeah, and having multiple options, I think is.
Yeah.
Yeah.
It could be overwhelming, but mostly I think having multiple good options, and then like getting consent from the person that they can come to their house and their address can be involved in this scenario, or if they call and they're like, you know, I don't really feel comfortable getting my home address involved in this scenario. I'm gonna meet you somewhere and I'll put you in a hotel for the night or something like that. Or if there is like a shelter or something like that, that we can work out as a county, having that.
Up to Ruth Haven House for those cases, or Jefferson House for the, if it's the other way around, but just for a night, you know.
Even,
for
yeah,
a
county
short-term thing to,
fund, or there's grant proposals going out now of funds where even you provide, and like maybe until we have a shelter, but can shelter someone, like you said, in a local hotel or motel for a night. Like that could be something.
I don't know the parameters that Jefferson and I don't know what their protocols are.
Yeah, I
That's
don't know.
something that they can even do or not do. I have no idea on that one.
Yeah, I think for short-term thing, like you said, maybe it's for overnight, so. Anything like that. It might be worth a discussion with them just to see. Cause I just think, you know, I mean, there's the old adage, if you build it, they will come. And so I think that's always been something you try to balance out, cause people are like, why don't you build a homeless shelter? Because there'll be a lot of homeless folks coming this way, so. And I know you, when the weather gets cold, guess where the homeless shelter's at?
And unfortunately,
1150 Barrett Gateway.
yeah. You know, and that's just a whole nother situation because most of them need, you know, mental health help, you know, to get, they don't need to be in a jail.
No.
But with the state hospitals closing and mental health at a increasingly alarming rate of increase, it's hard to combat that problem.
That's why shelters with resources
Mhm. Tapped out.
worth their weight.
Mhm.
So I know that you had shared that this is an issue that is becoming more and more prevalent within our community and nationwide. But also I imagine there's like seasonal patterns as well, that
Mhm.
probably play into it, but like, what kind of call volume are you getting about issues of this nature within our community? That way I could just imagine what a facility might look like in size or something.
So primarily domestic violence. I'm not saying it doesn't exist during the day, but it's typically a nighttime call. And I would say in a month's time, without pulling CAD numbers, just merely off my head, I'd say probably right around a third of our night shift calls would be some form of domestic violence, whether a verbal disagreement that gets out of control according to the neighbors, that wasn't really physical, it was just a husband and wife didn't agree on where they wanted to have dinner for the night or something, you know? And, I'm not saying that every one of the domestic related violence calls are something that would require a shelter or more physical violence. We have a lot of verbal domestics that you can go in and separate the two for 10 minutes and have a little chat. Hey, you know, you wanna go upstairs and watch a football game, and, you know, you can, you know, all go outside and sit in the hot tub for 20 minutes and we'll cool off and reconvene. And, you know, you can solve things pretty quick that way. But yeah, it's, domestics is probably the higher percentage of our call volume on night shift.
Along with additional training, would you see value to having like on staff, like counselors or social workers available to deal with those situations that aren't violent but could lead there without mediation?
I could see a potential benefit to that in some cases, when you mean on staff, you mean like employed by? I would say probably not realistically feasible. It's a struggle to get enough money to fund what we have now, more or less, than to get, I mean, if the council wants to give me the money for it, I will gladly employ it.
I mean, we've got a huge foundation.
Bethany, you know, Bethany.
Yeah, I mean, if there was grant funding or something out
Bethany
there.
Foundation's grant
Well,
proposal
for
is
sure.
open right now, and the focus is mental health and substance abuse. So I think that's like, you know, low spending. I have a meeting with them coming up, throw out some ideas. I don't have any grant proposal written, but just some ideas of what's working in the community that I'm working in right now related to those things. But that's, I know Marion County is doing it
Yeah.
with what you're talking about. Of course, we're much smaller, but we still have these issues, people that are suicidal, and so officers are called out for that, and you know, maybe something the county could get a,
I mean,
Report?
it wouldn't hurt if it was something that was available. I cringe because I struggle to get, you know, it's a uphill battle to get, you know, our spots filled, and then to throw that out there, but if there was grant funding for it, or it was a part-time position, like an as needed, hey, we're in a sticky situation, you know, can we have someone to call to give us a resource on scene or something like that? I don't see where it would be, negative. I think it could be beneficial.
I think, like I said, some more training for folks. Not that that's gonna be the whole part of the job, but at least those guys are out, and then having the resources, cause I think, you know, there is the state bill on mental health, and then we got the Bethany Legacy Foundation all coming together, and I think they were thinking, okay, there's gonna be a mental health response team, but it's in, I think it's Clark County or Jeffersonville, so, well, maybe with the funding, we have our own locally, and it would be on a part-time kind of basis. So I think, you know, we have I'm pretty sure Safe Passage said they do or I think you were saying that they would do the training. I think that's a good first step, and then we develop, and then we reach out and see if it's Life Spring or Centerstone or one of those guys, are they thinking that they might use some of the available grant funding for Jefferson County in that way? And, or others.
yeah, I mean, you know, and it's like so many different areas these days where we see shortages in staffing. I think the statistic that I read was somewhere around like Jefferson County meets these requirements to be like mental health, I don't know, sleep desert, and the fact that we have one mental health provider per 800 and something people, and like the state average is one in like 540 something, so we're really struggling with our number
Sure.
of mental health providers, but hopefully with this funding and focus in our community,
I'm sure
that's
that's,
something that could be
something they're trying to address, you know?
Yeah. Yeah,
I think it's worth, I think she would be, Nora would be more than willing to come and talk to us and
Oh.
talk about things and
yeah,
kind of put us
Absolutely.
right. So I mean, that wouldn't bother you, but I think if safe passage in the big training room, that's definitely a good,
Yeah.
a good first start.
They'll be here in April.
I'll be here at our meeting in April.
It's got-
And it'll be Chelsea Markham and Kim Bowman. Kim is the director at Safe Passages. Chelsea was who I had worked with in the past, and so I reached out to her. But
Bethany Legacy, we just got done completing, we had 2 days of training put on by Bethany Legacy. They had, human trafficking training the last 2 days at the sheriff's office, so. Dora was actually there yesterday, so it's the first time she got to come in and see the place.
First time she got to go to jail.
Yeah.
Yeah, and it's just, I don't know, I can visualize things coming together sometimes because that's how my brain works, but this idea that there is a window of time when you typically see these cases and knowing that, just knowing that during these times, somebody could be available, to be an additional resource for y'all. And then mentioning how having the conversation is such a challenge. And to give somebody a space to have a conversation with like a mental health professional or a social worker who's like trained to help people through those processes. And it doesn't have to be like in a police vehicle. It doesn't have to be in transit. It can be like in a safe space. Like those things seem to like really follow more of a process of getting people down a path that they need to go down rather than giving them like options that aren't all that great. Because we don't have resources, so, or the resources we have are on paper. Human resources, I feel like as much as information is valued, being able to talk to a human about something
Right.
and not have a time limit or not having to worry about them going to another call or something like that is a really big deal, I think, in those situations. But any other questions? Well, I'm really excited.
Yeah, things are going.
That's very
No, no
interesting.
problem. And, if, we could always, loop in Chief Scudder as well and get his perspective as well as far as MPD side of it and see what trends they're seeing in the city as well.
Oh, one quick question. You said about a third of the call volume. Do you know like a general average of the number of calls you get in an average day?
It varies drastically
Okay.
depending on season.
Yeah,
The
Oh,
level
sure.
of director,
okay.
Yeah.
Get the data.
We can definitely run the numbers. I can tell you.
I'm just wondering if we're averaging one a day or if it's like 30. Because I have no idea how to scale that in my brain.
We're like between 0 and 5.
Right.
And since we have a centralized dispatch, so then are we talking?
Yeah, that was-
City and
yeah.
county, right, numbers.
I thought I had to my other phone, I believe. I had some numbers pulled on my other phone. I apologize.
Okay.
It was drug-related arrests and some call one. So I was gonna give you the narcotics-related call volume and arrest statistics for the last 3 months. But it is, so that way you kind of have an idea of that's the upper, we'll say that's 2/3.
Okay.
So that would kind of give you if that's 2/3, what your 1/3 is looking at there, but it's on my other phone, so.
Reach out to Brandon.
Yeah, that's in the easy with Zerker, where you can run that pretty quick.
Yeah.
So.
Very interesting. Thank you so much
Yep,
for
no,
coming.
no problem. No problem.
Enjoy a long day. You can stay if you'd like.
Yeah.
or you-
No, we've been, I gotta get back over to the office. I've got, 2 pickup trucks worth of evidence to log in. So. We've been going since 6 AM, so.
Hmm.
Yep. Been a busy one. But if you guys need anything, don't hesitate, reach out, let me know if I can do anything to help. We'll be glad to help. And then you said the next meeting is April
25th, I think?
25th. Okay,
Same place, same time.
all right, well, thank you.
Thank you.
Yep.
Thank you.
We appreciate your time.
No problem.
All right. So we're still in the section where we're talking about action steps, and one of them was to talk to people about what we talked about last week. So, some other things. We confirmed safe passages for April. Dave mentioned that, we could put a link to safe passages more visibly on the county website.
We got that taken care of.
Got
She
that.
put it into like community resources and put some of the things from the clearinghouse and things like that.
Wonderful. Nice. Let's see. I think some of the things on here were follow up from helping out with the SAVE vehicle. I think Cammy mentioned following up with the Chamber of Commerce again. Did you hear from them at all? That's all right, we can extend it to next month. We keep having these meetings, so. Was gonna follow up with BJ because, you weren't able to come to the last meeting. Were you able to find a point of contact at Hanover College to connect with Kindness Jefferson County for the vehicle?
So I talked with a few different folks around campus to just inform them about this resource existing. In particular, I was thinking, it was with education faculty that I know has an interest in like special education as maybe a thing. I think what was really hard to sell as it being really exciting is it seemed unlikely that connecting college students as ongoing volunteers was a strong interest. Given the training needs and typically the seasonal of staffing it.
Yeah,
And
since they're
so-
not here in the summer.
Yeah, so like I talked to folks about it, they're aware that it exists, but that's kind of where most of my conversations stopped. And I'm curious if you have recommendations on maybe alternative, like, is this a thing that would be better if I'm talking about with folks that might be interested in booking the vehicle for an event like homecoming or whatever
Yeah.
big things happen in the area on campus, or is this more, are we trying to get volunteers and things kind of pipelined to help support the program?
I think you're specifically looking for volunteers,
Mhm.
but I mean, it doesn't hurt to make connections in any way.
Yeah.
I would say maybe a next step would be, since the nature of college students is to be very busy and then to not be here, to maybe focus on to see if like faculty and staff, or perhaps even like internship opportunities would be options. Cause that's one things where students can get involved and stay for, like to do an internship. I would say look in that, because it is harder with students who are like residential, but then leave in the summer. They miss most of the events and wouldn't be available to volunteers now.
But I do think that's a great idea about like homecoming, like
Right.
situations where there's gonna be large crowds and.
I think they've already had at least one event on campus that they went to, so I don't know if all the connections are made yet, but they're starting to make them. All right, thanks, BJ. Next we have. Oh, I was gonna follow up with Scott Murphy about, contacts at KDH. For the vehicle. I did follow up. He did make connections and connected Mike Sims to the person. And I might follow up with Mike Sims to make sure that that connection worked. But, because I don't know if the connection actually happened or if they were able to make contact in a productive way, so we'll see. Next, Dave, you mentioned that the email would be set up.
Yeah, I tried, I forgot to submit, I talked to Sarah, but she said, I'll get it, well, I won't get it tomorrow, I was gonna do it tomorrow before, but I'll get it there next week. We just need to send an email to our IT folks.
Cool. Highlight it to follow up next time. And then the last action item was for all commission members to share the application for the HHRC membership with anyone they think would be good additions to the commission. Did anybody get to like? I emailed some people, but they told me no. So I think we just keep this one on there.
Sure.
Yeah.
I'm still pressuring Dr. Murphy. He said, okay, you want all, you gotta give me somebody. So there's my action. I'm gonna
Make
keep
some
that.
ideas.
Although he got sick this month, so I backed off a little bit. He had pneumonia.
Yeah.
In particular, is there a need or an emphasis for particular skill sets, like health representation, or do you think that's something that is pretty well represented by our current group, or?
It's such a broad field. I don't think it would hurt to have more healthcare related people involved. I would honestly love, people who have the ability to be bilingual, like more people. Cause I know some of us can do that, I cannot. I'm terrible with language. Just so that we're accessible to the whole community mainly. And yeah, I mean, healthcare is great. I don't think anybody would be unqualified if they aren't connected to healthcare, but
I just didn't know if there was like.
mental health would be a big one too. Since we are in a mental health desert. It'd be great to have somebody who can weigh in on those topics since they are so heavy here. So I'll think about that too. Makes me think. So yeah.
We've got a committee looking at options for, is it residential treatment? Is it a collaboration between different counties for a residential treatment? So we have some folks there in the mental health realm. I'll see if there's maybe someone there.
Sure.
That would be.
Yeah, I reached out to 4-H. They do a lot of help and advising and different things, and they're trying to hire a new person to oversee health and human sciences there. And if they hire somebody, they told me to reach out to them.
Welcome. Get involved in the community.
I think that, I mean, the health department is hiring someone to be a liaison with the schools in the health realm. I wonder if another duty as assigned thing for that.
Sure.
I'll talk to Lindsay and see. So while you're talking to them, see if they might want to be.
So yeah. I mean, we're pretty broad. So lots of ways to fit in, but specifically those things I think would be great.
And I think, when we first started, we talked about providing some services that are difficult for folks to get to, talked about just nobody, and I don't know if you can force a dentist to take Medicare or Medicaid, I don't know if you can do that, but can you provide services where they can do that? And so we were at a meeting on Tuesday, and one of the things that, one of the people there that was speaking brought up is that they're taking some of their money that's coming from the state, and they, I don't know if it was a trailer or like a Class A mobile home, but they were making that a mobile medical facility, and they were gonna try to go around places in their county to provide that for folks.
Sure.
And so maybe that's a way, not that that addresses a person, but maybe we can book somebody who's working in something like that in, anyway, we thought that was an interesting idea, so more discussion with Lindsay, because she's the one who's, because her funding next year is double from what she got this year. It'll stay at that level, the way the state has kind of laid it out, but.
I would love a Medicaid trailer.
Well, something where they could have, and it could be, in 1 month, it could be dental work, and another month, it could be just health screening. I mean, you could have some different things going on.
Right, because we've discussed the challenges that our immigrant community has in getting health physicals for school and sports and after school activities and along with the dental issues and yeah, I'm sure there's even more we haven't even dipped into yet. So yeah, maybe at times it could be a mobile mental health clinic where they can have appointments there. I don't know, a lot of possibilities, but yeah, I think that's exactly the way we should think about things.
And especially, I mean, with, we should be involved about the legacy, I mean, yeah, it would be, I won't say foolish, maybe you can say foolish, if you didn't try to take advantage of it,
Mm.
and at least get the ball rolling in that, and I think once the evidence, because it's sometimes hard to convince folks, yeah, that'll work. So getting them to convince that it does work, that then the funding is a little easier to obtain than, oh, this is a great idea.
We
Sure.
can make it work.
Oh, yeah, well.
We have the money.
Sure.
It's, a lot of the things we're discussing are not like unstudied things or things that don't happen in other communities. It's,
Sure, but sometimes it has to be in yours before it gets full buy-in. I know it shouldn't be, but.
yeah, but I guess that's why we're here. We're
Sure.
trying to bring the ideas.
Yep.
So, yeah. Okay, are we good to move to our next agenda item? Anybody have any more updates from action items that I haven't touched on or that I forgot about?
No, I apologize. I keep checking my phone. I may have to step out. I have a dog who may have overdosed on melatonin. That was for a steer and not for
Hey, man.
and not for.
I mean, it's on topic though.
Right.
Okay, if you,
Okay,
yeah.
so that's why I'm checking my phone to be rude during a meeting.
Absolutely. Whatever you need to do for that sweet pup.
Trying to get the milligrams right now. I know a steer takes much more than a 30-pound dog.
Ooh. Wow, yeah, okay. All right. Yeah, whatever,
All kinds of overdoses in the community.
Now the animals are getting involved, my goodness.
Oh, sorry.
Gonna be one tired pup.
Yeah.
All right, so next on the agenda, time to review any online agenda submissions. I did not see any. I can double check. Just in case, since I missed April in that one email. Okay, yeah, I don't see anything. Good enough for me. Okay, so no online submissions, for agenda items, time for public comments. I don't think we have any. Number 6 is new business from HHRC members. I have just a couple things to revisit, but if anybody had anything they wanted to bring up, please go ahead.
So I did want to bring up, and I did not want to put Sheriff Flint on the spot this evening because the things I want to bring up do relate to the jail and health and human rights and all of that, but that's not why he came here tonight.
Okay.
Question any of that, I think, if you don't know, that there was a death at our jail this month. As far as I know, it's the first death in custody that our county has experienced. I don't know that there's ever been another death in custody, before. So, just some concerns and questions about that, and I'm not sure. There's an ongoing investigation, right, when something like that happens, so I'm not sure what all information we can get at this time. But I definitely have some concerns as somebody who previously worked on the healthcare side in correctional facilities, including our own here. And just wanting to make sure maybe some of the, previous, so when I was, the site manager at our county jail, I was able to obtain a grant that got us, I think, around 300 free doses of nasal Narcan. And went to Sheriff Thomas at the time after I'd gotten that grant, and I got it 2 years in a row. So we were able to distribute extra doses into all of the deputies' cars, but, Sheriff Thomas also changed policy in the jail to where it was required part of their uniform for all of the jail officers. And they got pouches that attached to their duty belts, and they could carry a dose of Narcan with them at all times. And there was plenty to do that. So anytime new officers started the jail as part of their medical training, I did training on how to administer it. And we did have 2 overdoses at the jail. I'm not saying, I don't know anything about this particular case, if it has to do with an overdose, but, it was life-saving. Twice while I was over the jail, people were administered Narcan inside the jail. And the sooner you can get it to somebody, the better. Nowadays with fentanyl, it often takes multiple doses, and then an IV drip at the hospital, all kinds of things. So I just want to kind of check in and see if that is still policy, if we're still doing that at our county jail. If they're still reaching out, because we do still qualify as a rural grant. Certain counties based on our overdose rates qualify for this grant for first responders, including, police and county and jails. So just kind of wanted to check in on that. And, I'm guessing the council and the county commission are looking at things like, I know there's a lot of the current contract provided they have, there was a lot of open positions for, healthcare providers at our jail right now, and hoping that they're getting more people and that's being addressed. I don't know. It's just concerning, you know, for everyone.
I mean, I think once the investigation's over, then there'll be more, obviously more information that we can talk about.
Talk about.
So, yeah,
Okay.
so.
Yeah.
Yeah, that was a very sad situation. So. I hope everything goes well with the investigation so that we can address whatever it was that went on. Yes, I hear your concern. And do you know Sheriff Flint will be back at our next meeting Wednesday? Passages are here, or could we send him
It'll be-
Sounded like, well, send a reminder, and then I think that was my task item, maybe to reach out to Scudder about coming, chief of Madison Police. Have we split that up where you were gonna reach out to them and I was gonna reach out to Scudder? I don't remember. For some reason, that's what's in my head from the last meeting, but maybe not.
Yeah, in collaboration.
Yeah. Yeah.
But it was for this month.
I'm sorry.
You're fine.
And I don't
I read
remember
too fast.
Hanover chief's name, but we should reach.
Hmm?
Hanover
Hanover,
Shane.
Shane.
Shane, yes.
Okay, yeah, I see Dave in collaboration with Cammy. After state passages confirms, to basically invite Madison, Hanover, and county law enforcement, so, yeah, okay. So, yeah, it's on both of your plates.
All right. We're gonna hear.
Collaboration,
Do you want that reposted as an action item for this month?
sure.
Since we know state patches, this is good one in April.
Yeah.
But it was really helpful to hear that tonight. It's just
Yeah.
like a baseline of what they have.
Yeah.
And to have some fun brainstorming. And grant talk.
Mhm.
I can help write grants, so
Oh, yeah.
I'm not busy right now. I'm not paid to get anything right now, so I can do stuff for fun, for volunteering. So yeah, next on, well, the next thing, did anybody else have new business? Okay.
Yeah, I would, this isn't, I'm not providing any information, I'm just curious about, we had a tornado, like, and I was just curious if there was any ways in which there was impact that y'all were aware of that we should know about, or is everything super fine? I've just, like, I've seen some damaged homes on my commute, like, even on my way here, and I was just curious about, what do we know about that?
Very quick.
Mhm.
I mean, it went to tornado warning, like, is there a storm?
I remember like the alarm went off on my phone, and it was a bright sunny day outside, and I was like,
Right.
what is happening?
So I mean, I think the official number was like 99 structures in the county had some sort of damage, but that's garages and outbuildings and stuff like that. I mean, there was one, the Country Manor, that's the one on 256. There was one house there, and then in Jefferson Manor, 1 and 2, 3 or 4,
62.
and then the one on 62 and back, so there's, I think 3 or 4 had some pretty significant damage in Jefferson Manor. I'm sure there were a couple others that had maybe some shingles removed and stuff like that, but probably the one that was hit the hardest was just the new house back in Jefferson Manor 2, that, you had to look at Google Earth and what the picture looked like before and see it now. It wasn't a 2-story, but it was a very tall 1-story, maybe like 1.5-story, and that whole top was gone. I mean, it's still amazed. I mean, and then so the house behind them, so to speak, in old Jefferson Manor, it looks like the roof was lifted, the curtains were pulled out, and then the roof went right back. So you drive by and you see the curtains outside of the house, but they're coming up over the wall, not out the windows. So, but obviously there's some pretty significant damage. And then the one across the street from him, his garage roof looked like it was taken off, but the rest, I'm sure there were some shingles, but, and then it hopped up, and then it hit the one on 62, and then it went down the hill. And really, in Jefferson County on this side, that was it, until it comes back on Sandy Beach and hits their RV park. And then there's another house on the hill, and then I don't know if there's another house in Jefferson County, but then it crossed into Switzerland County. And it's funny, as you drive down, you think, well, man, it is zigzagging all over the place. Well, really, it's going pretty much straight east the whole time. But, like I said, I think 99 was the total, but unfortunately, there was, I think, one person, I don't know what they finally decided, but they either had a heart attack or had chest pains. Was it due to the storm and the anxiety there, or, I don't know. And then the other one I heard is that a lady in Jefferson Manor was watching the storm, and a 2x4, some of the debris came flying through her window. And I think she got hit with some of the glass or something happened to her arm, but that 2x4 ended up being driven through a steel door in her house. Missed her, but it was just that much force coming through, but there was no one in the RV park because it's March, and no one was there yet. But you drive, you keep going, so, so I drive to Carrollton when I go to work, Tuesday through Thursday, but, as you go down that, well, I can't say that, it wasn't every RV that was parked along the river. Some are fine, some, there's nothing left but the metal frame on the bottom. So right there in Milton, there was a fifth wheel sitting there for years. nothing but the frame is left. And then you go to that next part, well, there's some sitting there and it's hard to
So
tell.
that next park, my daughter's boyfriend's family owns that with the 2 tiny houses and
Hmm.
a couple of campers. And all of theirs were parked like horizontal with the river or like parallel with the
Parallel to the
river.
river.
And theirs were all, a few of them were like moved, but no damage other than trees and stuff around it. But then everybody else on
Yeah, I
either
mean,
side
that's
of
what it
them
looked like.
that
You
were perpendicular,
you got
rolled
lit.
and destroyed and.
And then you go in front of the plantation and they had the tiny houses that were hooked together. I don't know if anything happened to them, it's hard to tell, but there was a big Class A mobile home, I mean, or motor home, a big diesel pusher, had nothing but the frame. And then there was another big fifth wheel, nothing but the frame. So I mean, I don't know if
Were
anyone,
you at work when it hit?
yeah,
So, me too,
Close to
and
the
but I'm
basement.
due to move, going over to Carrollton. And another friend that works over there, I think with you, called me and said, how are we getting home? And I was like, I don't know, Markland, and she's like, no, my dad lives by Sandy Beach and his place is gone, 56 is. And I was like, I don't know how to get home, I guess
42,
I'm just staying here,
42, that's.
Yeah. yeah.
But then, so I mean, it kind of disappears. It had to go up into the hills in Kentucky, and once again, it looked like it was going south, but really, when you look at the overhead map, it was just going east. And then you get about halfway to Carrollton, and it looks like it just comes jumping down the hill right opposite where Sandy Beach is, because, I mean, those trees, I mean, it's like a bulldozer came down the hill and then crosses the river and then goes over to Sandy Beach and, and Sandy Beach, the west side of the RV park, I mean, they were just destroyed. The east side, you had a couple RV parks that, the covers for them, that looked like they got moved, but nothing.
Nothing.
There was a barn right across 56 there, level. And then you had a little bit of damage to some houses, but it was,
But I mean, I haven't heard, you would probably be more thumb on it, about any displaced families in our county from it.
yeah, I've heard,
I mean, I
I've heard of
know,
like a family living in a hotel because their house was destroyed, but
we have
I think people just know about that and have been trying to help out,
right.
like, as a community.
Yeah,
I don't know if there's like any organized, like county or city, like structure to like help families who are in those situations, because this tornado specifically was like drawing a line, not like a huge swath, like, I mean, some hurricanes going up and south.
it seemed like it would jump up, go on, and then come down, hit a couple, and then jump back up.
So
And
it's like, it's not like where you're calling like the president to get.
right.
and I think the governor.
Governor of
declared
Kentucky
this-
did
Yeah.
visit over across
Sure,
the river.
Jefferson, right,
Yeah.
but I think the governor of Indiana declared a declaration of emergency, whatever they called it, but for our county,
Oh,
so that was last. It was Monday or.
But like
Tuesday.
FEMA's not helping people out.
Well, so you have to do an assessment so the Indiana Department of Homeland Security is working with folks.
Okay.
So, but they do their assessment, and if it reaches a certain level, then FEMA would jump in. So they're trying to decide or figure, you gotta go through, gotta do a process to figure out. And then they'll submit it to the state and see if the state will see if it's reaches that level, but there are, resources for folks to call to report their damages and get that government ball rolling to provide some help. But I think, like you said, it was so haphazard that there are individual groups that are coming down and helping people clean up and helping them do, so.
I mean, I was kind of trying to keep an eye out, like, I've got chainsaws.
But,
But then I know liability is an issue, so I don't wanna like go and help out and get hurt and then have to like be a mess, make it worse,
yeah, but so those groups are coming and, they're still taking care of folks. I mean, Matt True, the UMA director, said, he's been, I don't know if he said very pleased, I don't know, but it was good to see people just reaching out and helping other folks. I mean, I think it's a little sad that it only happens when something like this happens, But still, you know it's there, and they were going out and helping each other.
I do think that the kindness group has been pretty good about starting that kind of activity in general in our community, but I mean, they're a nonprofit, but they're not like super connected to government agencies to make that stuff happen all the time. So I don't know. Yeah, I'm kind of like, oh, I want to go help, but I don't know how. I don't know if there's a way to, yeah, to do that. or organize
Typically,
that.
I mean, I don't know from this one because it was like not as large of an area.
Sure.
I mean, I volunteered with the Red Cross following the Chelsea and Henryville tornadoes in 2012, right? Yeah. And so because of the area, I guess affected, I mean, there was, I don't know what it's called. There was an area set up for us, right? Like at a local church, and that is where volunteers would meet. That was where we set up temporary food pantry, supplies to families, totes, tarps, then a Red Cross nurse on duty. More so, I mean, this is days after, so I was more just like putting Band-Aids on people that are helping with cleanup and are getting cut or whatever, but I don't think this, on our side of the river, at least, or here in Jefferson County, is
Yeah,
something that
exactly.
called for that type of operation here in our county again, thankfully,
Yeah.
right?
There were several groups, I mean, that next day, Friday,
Right.
coming in to clean up, help gather up all the debris and stuff, and
Mhm.
get it, the county, there were some that brought in dumpsters, and the county provided dumpsters in those areas, so people could get rid of the
So
debris.
Lowe's locally had donated some supplies, and yeah.
That answer your question.
They're like, wait, what do you want?
All right. Yeah, that was really scary. But it is nice to see people coming together that way. Any others, new business? Cause I was just gonna revisit our last meeting, they've mentioned, that, with fire hydrants, they're tested every 5 years. And I just did some Googling and that's like in accordance with like a national standard for flow tests.
Mhm.
But it does say that inspections should be happening annually, so I wasn't sure if that was also folded into that. Like 5 years, do we also do the annual inspections?
Right, so I mean, the flow testing is that 5 years, but yeah, they're going through
Okay, cool, so they are doing, and logging all
them.
the inspections. Did you have any information about with the one fire we had back in, was it October? Or September? The trailer fire where the teenage girl passed away. Like, it was noted that the fire hydrant wasn't working, not that that would have really helped in that situation, but like, did they have on log when it was last inspected?
I don't know on that one, I mean, I was talking to some fire chiefs, so I don't know who has that district, but I can see what I can find.
All right, cause that's like just my nightmare. Like, oh, it doesn't work. It's just like, what nobody wants to have happen, so, especially not our people who are there trying to help, so.
It's like not my favorite, having the fireball, is that what it's called? Fireball war is like right in front of my house now, but it also gives me some solace, like
Okay.
mine's working.
Just don't leave all the water.
Yeah.
Like, I just have like block parties every time we do the hydrant, so we can just make sure. But yeah, that was just something, since I looked it up, just to know for myself, just wanted to make sure that was all good with that situation and kind of if they had figured out why that hydrant wasn't working, just to make us all feel really good about it. So scary. Okay. that was the one thing I wanted to follow up on. So I think we're done with new business. So number 7 is upcoming meeting dates, April 25th, May 30th, June 27th, and July 25th. I think I'm gonna have a lot of plans this summer, and I'm doing my very best to plan around meetings, but might miss one or two, so I'll try to coordinate with Amanda on that if I can't be here, to try to make sure she's here. Since she's the vice chair. But as far as I know, I'm gonna be here for those. Maybe not the June one, we'll see. So to review action steps for our next meeting is number 8. Do you have those grouped together yet?
Yes, I do.
Okay,
So far, I have 2 things on it, and it was the, Kimmy Kelch and Dave Bramer in collaboration, coordinate safe passage in local law enforcement entities at a future meeting in April. And then the note for all individuals on the committee to continue make referrals to the application.
okay. All right. Did I have any others?
I think everything else was mostly just updates on
Yeah.
past ones.
Yeah, Dave's gonna check on the email and sure it gets set up. And Kimmy's gonna follow up with the Chamber of Commerce again. We're all gonna try to get more people to volunteer for the paid vehicle. Okay. Wonderful, so, number 9 is to move to adjourn, so I move to adjourn our meeting.
I second that.
Okay, you're second.